Okay, we're going to talk about the bones of the hand and answer the questions: what are the bones of the hand? What are their primary bony landmarks? And what are some reasons to learn about them? Hello, everyone. My name is Dr. Morton, and I'm the noted anatomist. So to begin with, let's talk about the principal bones of the hand. If we zoom in on this anterior view of the hand on the right side, and we're going to spin it to make it easier to look at these bones. And those bones consist of the carpals, the metacarpals, and the phalanges. And we're going to go through each one of these one by one. Let's start with the carpals. And the carpals is a Greek or Latin, I can't remember which one, for wrist. So whenever you see the word carpus or carpals, think wrist. And in the surface anatomy, take a look at that crease. And that crease is showing you the location of the carpal bones. But if you go right in the middle of the crease and go distal, about a postage stamp size, there is an area called the carpal tunnel. Let's look at that in a little bit more detail. All these carpal bones form a concave surface. And the concave surface of these carpal bones has a top or roof called the transverse carpal ligament, transversely going across from one side to the other. It's also called the flexor retinaculum, and it's made of dense, regular collagenous connective tissue, extremely tough, almost as tough as bone. And the transverse carpal ligament and the carpal bones form a carpal tunnel. Now, the tunnel is not empty. It contains 4 tendons of the flexor digitorum superficialis, 4 tendons of the flexor digitorum profundus, and 1 flexor pollicis longus tendon. And these 9 tendons all are wrapped in these synovial sheaths, shown here in blue. And there is 1 lone nerve called the median nerve. Those are all the contents of this carpal tunnel. Basically, it's a connection between the front of the forearm and the palmar surface of the hand. Now, what happens is if you have an increase of pressure in this carpal tunnel, the most delicate structure, the median nerve, is hurt. And the sensation part of carpal tunnel syndrome is numbness along the distribution of the median nerve, as shown in the color red or pink in this picture. Now, there are 8 carpal bones that are organized into 2 rows. If we put this imaginary line, there's a proximal row of 4 carpal bones and a distal row of 4 carpal bones. And if we choose this bone here, which is on the radial side, and there's the radius and there's the ulna, and now we take a look from radial to ulnar side in the proximal and then distal row, using this mnemonic: Sally left the party to take Kathy home. Sally left the party, go to the distal row, to take Kathy home. We get these letters, the first letter of each of the carpal bones. So let's go through each one. Let's start here. The letter S stands for scaphoid, which is Greek for boat, because if we make an outline of that bone, it kind of looks like a boat. Now, in this view, it doesn't look so much it, but in this view of a photograph, that with the arrow is showing the scaphoid. That looks more like a boat. The scaphoid articulates with the radius at the radial carpal joint, and in surface anatomy, it is found at the floor of the anatomical snuff box. Clinically, if a scaphoid fracture is the most common fracture of a carpal bone, and so if we look at a normal scaphoid for a minute, this blood supply is unique. As the radial artery courses by, it's almost like the radial artery said, "Oh, we forgot to give blood supply. Let's send an artery back to supply the scaphoid." And as a result of this distal to proximal arterial supply to the scaphoid, if you have a scaphoid fracture as shown there, then the proximal portion of the scaphoid cannot receive blood supply, and it can become necrotic and die. So it's important to watch Fuchs injuries, falling on outstretched hand, to ensure you do not have a scaphoid injury. Next, we go to L. L is for lunate, and lunate is Latin for moon, because if we take this bone out, it kind of looks like a moon. The next letter is T, and T is for triquetrum, which is Latin for 3 corners. This bone articulates with the pisiform, the lunate, and the hamate, 3 bones. Sitting on top or superficial to the triquetrum is the pisiform bone, P for pisiform, and that is Latin for P-shaped, because if you take an outline, it kind of looks like a P. Now, that was the proximal row and the 4 bones. Let's now go to the distal row of 4 bones, starting on the radial side. And the first one is the letter T, and that T stands for trapezium. I remember this because of trapezius thumb. This is the carpal bone that articulates with the thumb, that forms a synovial saddle joint, and that enables the opposition and reposition movements. Next letter is T for trapezoid, which is Latin for table. It's a wedge-shaped bone between the trapezium and the letter C, which is for capitate. And capitate is Latin for head, because if you pull the bone out, it kind of looks like a head. And finally is the letter H for hamate. And hamate is Latin for hook, because if we take a look at the hamate bone here, then red, you see this little hook come up. It's called the hamulus, which also means hook, so it's like the hook on the hook. Now that we've done the carpal bones, let's talk about the metacarpals. And the metacarpal bones, they get their name because the prefix meta is Greek for after the wrist. These are the bones after the wrist, and they're numbered 1, starting in the thumb region, 1, 2, 3, 4, and 5. And these are the bones that are found in the palm of the hand in this area. So there's metacarpal 1, 3, and 5. And the middle shaft of the metacarpals is the body, and the distal portion is called the head, and the proximal portion is called the base. So those are the metacarpals. Next, we have the phalanges. Now, the phalanges are numbered 1 for the thumb, 2 for the index finger, 3 for the swear finger, 4 for the ring finger, and 5 for the pinky. And if we then take a look at digits 2 through 5, they are composed of 3 phalanges, a proximal, middle, and distal phalange, whereas the thumb only has a proximal and a distal phalange. Like this: proximal, middle, distal, proximal, distal. Okay, so next we have some joints in the digits I want to point out. So this joint here, where anatomist said, what do we call the joint between the metacarpal and the proximal phalange? I know, we'll call it the metacarpal phalangeal joint, or MCP joint. The next one is between this phalanx and another phalanx. And so anatomists are like, what do we name this joint between the phalanges? Oh, we'll call it the interphalangeal joint, or IP joint. The problem is, digits 2 through 5 have 2 of these interphalangeal joints. So anatomists said, okay, we'll call the one closer to the wrist the proximal interphalangeal joint, or PIP, and the one farther away the distal interphalangeal joint, or DIP. So in the thumb, there's only the 2 phalanges, so there's simply the IP joint in the thumb. All right, let's show that again. There is the MCP joint, PIP joint, and DIP joint in that fashion. All right, that was fun. Now let's take each one of these and let's go through and do some practice problems to see how we're doing. All right, so here's an anterior view of the hand on the right side. We zoom in and see a bone. You're like, what bone is that? Well, that is the first metacarpal, second metacarpal. So then it goes proximal, middle, and distal phalange. So this one here is the middle phalanx of digit 2. All right. How about this? So we zoom in on these carpal bones, and you're like, all right, so the first row on the radial side, there's S. So Sally left the party to take Kathy home. So L is for lunate. That's the lunate carpal bone. All right, so let's do, where does the ring in the photo go in the bones of the hand? So we do it like this and find there's our fourth metacarpal, and we go to the next bone up. There's the ring. That is the proximal phalanx of digit 4. Digit 4. All right, so what about that joint right there? Well, that's between a metacarpal and a phalange, so that is the MCP, or metacarpal phalangeal joint. Let's do a little word problem. The adductor pollicis muscle attaches to the shaft of the third metacarpal and base of the proximal phalanx of digit 1. Identify the attachments using the following illustration. All right, so there's digit 1 and digits 2 through 5, and the shaft of the third metacarpal. So there's metacarpal 1, 2, and 3. So there's the shaft of the third metacarpal. And let's go to the base of the proximal phalanx of digit 1. So there's digit 1, there's the distal and the proximal phalanx at the base. There's the other attachment. So there are the 2 attachments for the adductor pollicis muscle. All right, there's an anterior view of the left hand and zoom in. So if you're going to look for that bone, we take the first bone in the proximal row on the radial side, which is S. So Sally left the party to take Kathy home. So C is for capitate. And that, my friends, are all the hand bones in a nutshell.